All right, and we're back with another episode of Black Life Amplified. It's the virtual town hall series hosted by the African American Leadership Forum. My name is Brittany L. Wright with Insight News, and I'll be your host for this afternoon. But before we get started, I want to give a very special thanks to our sponsors, which include the Minneapolis Foundation, Northpoint Health and Wellness, and Children's Minnesota for making this town hall possible. I also want to give a very special thank you to our organizers, our community partners, and producers, which include Northpoint Health and Wellness, Children's Minnesota, Insight News, Gray Matter, and Minnesota Community Care. All of those organizations come together to produce this town hall and make it possible. So be sure you check out the African American Leadership Forum Facebook page as well as their YouTube channel so that you can watch previous episodes of Black Life Amplified, and then make sure you like, comment, and subscribe so you can get updated on future episodes. Now, on today's episode, we are focused on centering Black men's health. So joining me for today's discussion, we have Adriene Thornton, who is a manager of experience and health equity at Children's Minnesota. Welcome back, Adriene. We also have my boss, Mr. Mack. He is the founder of Insight News. Welcome, Mr. McFarland. Also joining us is Thomas Collins, who is the founder of Mind, Body, and Spirit Holistic Fitness. He's also a Josie Johnson Fellow and a recent graduate of the Social Impact Fellowship at Minnesota Community Care. So welcome, TC, to the Town Hall. And then joining us again is Dr. Nate Chomolo, who is a pediatrician and Medicaid medical director. Welcome back, Dr. Nate. Glad to have you. Glad to have you. So while I have you all on screen, I first want to open up the conversation talking about the continuance of the COVID-19 pandemic. We are still in it, whether we like it or not. And so since we found out that COVID has been in existence, and particularly in our country, our world, and our lifestyles have had to shift drastically, I want to start this conversation by asking you, what has been the hardest part of the pandemic to get used to? Dr. Nate, I'll start with you.
I think most people would say just how long it's going on. We initially came together across many communities to kind of shut things down, and with an idea that we could at the time think about flattening the curve and get through it, and maybe it'd be a couple months and we can kind of get back to normal. And just the fact that it's kind of gone on, there's been some starts and stops. And I think for me, as a parent of a child who's too young to get vaccinated and is a little high risk, it's particularly hard because there's people in different stages. There's folks who have gotten their vaccine and kind of living life kind of more like normal, taking precautions. There's some folks who haven't seen the threat of COVID yet. It hasn't impacted them personally or enough to the fact that they've taken the vaccine or made changes, and so they're out doing what they do. And then there's folks who are waiting for whether there's little kids or other vulnerable members in their families that are at risk, that are still taking a lot of different precautions. And so I think that adds to the kind of other divisions that have popped up, throughout the pandemic. So I think the longevity and then there's these kind of folks in different parts of our lives being in different stages is really challenging.
It definitely is. TC, I want to go to you. What would you say has been the most challenging part of getting used to the pandemic?
For me, I'll have to say it's the mental aspect that come with it. It was a lot of isolation that happened during the COVID pandemic, not just as me, but for our community that I seen that was affecting people's mental health, and especially like if it's taboo and they weren't talking about it before the COVID normalcy, or where we're moving to, where people aren't as comfortable with being around others, or they're more conscious of being in big spaces with a lot of people, or even intimate gatherings. I had people or clients that were really cut off from their parents or loved ones for almost 6 months at a time because they were that fearful of what could happen. So I say that was the biggest or the most difficult to adapt to, is the mental aspect that came with it for me.
I would definitely agree there. Mr. McFarland, what's been the most challenging part of the pandemic for you?
I'll flip the question, Brittany, and talk about the benefit that's come. And for me, the big benefit is that I'm not doing all the meetings I used to do. So I used to do meeting after meeting after meeting after meeting, and it was taxing, burdening. And, I'm thinking about all the time I've saved. Because what I do now is come downstairs to my dining room, and I can meet as many times as I want to without leaving my house. It's safe. I'm not exposing myself. So I've learned the value of telework, and using this technology, we basically shut down our office, so everybody's working remotely. I think that's a huge plus for the company and for all of us to be able to continue the work, actually to work better, to be more intentional in all we do, and be able to do more by not having to waste time in travel and transit. And also being aware of the good reason to adopt the protocols that will ensure or support healthy interaction, et cetera. So, I, like everyone else, decry the pain and the discomfort and the deaths that our community experienced. And I, like everyone else, am grateful and thankful to those in the medical profession and in the other frontline services for their courage and for their dedication to helping us be safe. I mainly, at the end of the day, want to continue to be an advocate, encouraging people to get vaccinated, to get the booster shot, to adopt both the vaccine strategy and the other protocols that will help us be safe with each other.
Absolutely. And speaking of people who have been on the front lines and dedicating their lives, Adriene, I want to ask you, what has been the most challenging part? You were literally on the front lines. Just a few months ago, you were an infection preventionist. Your work was in preventing these type of outbreaks, and yet here we were in a pandemic. You were working around the clock. How have you been navigating all of this?
I've gained a few pounds. I definitely felt the stress of the pandemic because we were so busy, we were working so much, and it's showing in my health. I will just be transparent. My health has suffered over the last year. I've had several visits to the emergency department. My heart and my blood pressure are just out of whack. The medication that used to control my blood pressure is no longer doing that. And I'm pretty sure it's a direct effect of being home, being sedentary, and having to work, long, long hours where you're sitting most of the time because we are work from home as well. And so that is the unfortunate consequence of this pandemic for me. Now, what it has also done is it has helped me to refocus. And so now I am in the process of, saying, how can I do better with what I have? So figuring out how to use the resources that I do have to improve my health, to not be quite as sedentary. I don't want to go out into the public as much as I used to, of course, because of the pandemic. But, how do I walk? Now I just walk around my neighborhood, which I never used to do before, just so that I can get up and exercise. I will walk around the lake, because outdoor activities are wonderful, especially in a pandemic. Even if there are people out there, I'm not concerned about transmission of COVID because we're outside and the wind is blowing and it's safer out there. So, it's had some good and bad. My children and I are closer, a little bit too close at moments, but we found joy in watching movies together again, and having regular meals together again because we were home all the time. And, everybody before the pandemic, we were all going in different directions. And, I had my things to do and my daughter had her things to do. And, the pandemic brought us back together. So that was really wonderful, taking a nap with your kids during the middle of the day, we had gotten away from that. And so I am very glad to have gained that. But I will tell you, I'm a little tired, even though I am no longer working in infection prevention. The kids are sick and they are filling up my hospital, and we are busier now than we were at the height of the pandemic. So it's a little stressful for us yet again.
Well, let's talk about that. How is this Delta variant impacting our young people? Because when we first encountered COVID, it really seemed like it was primarily impacting our elderly population, those who are immunocompromised. We didn't really see too much in kids, but now with the Delta variant, it seems like that has shifted. And when you and I spoke in our pre-production meeting, you said the beds are actually full, even in the pediatric wards or in the children's hospital. So what is going on? Why are so many of our kids getting sick?
Yeah, so that is a multi-pronged problem. So it's the
Mhm.
Delta variant, of course, because it is highly transmissible. It spreads really easily. But also, because so many adults are now vaccinated, the virus has to find somewhere else to go, and our children aren't vaccinated. So it's natural that, if you have someone that's unvaccinated, an adult that's around children, it makes sense that they would get the virus because they are not vaccinated and they really don't have immunity to COVID. So, what we're seeing now is what the adult hospitals were seeing at the height of the pandemic, with full beds in the ICU and full beds on their regular units and lots of people in your emergency departments. We're seeing that now, and we're
Mhm.
feeling the pressure. We've seen, wait times of 2 to 3 to 4 hours in our emergency department, which is unheard of. We have people waiting to be admitted, and it is just incredible what we're going through now. We never could have predicted that. I mean, we could have a little bit, but you add that to staffing issues because just like other industries, hospitals are experiencing shortages in workers as well. And that doesn't change just because children are getting sick, which is unfortunate. So it's just a lot of things compounding on top of each other that are making this really difficult for our kids.
And speaking of COVID, you had a graphic that you were going to show us about just how COVID was impacting our communities and the rates of transmission. Producers, do we still have that graphic?
Yeah, it's a great graphic that was produced by the Joint Commission. And what they did is they just wanted to give people some context because, you hear the stories about, oh, well, it's just like influenza. Oh, as many people die from influenza as they do from COVID every year. What's the big deal? And so the Joint Commission created a graphic that illustrates why COVID is so much more important for us to control and how it impacts the community in terms of deaths. And I'm still getting the circle of doom, so I will just speak to it. I'm not sure if you all are able to see it or not.
Yep, we can see it.
Okay, so it
So we're currently
starts
looking
off by
at the
just,
football field.
okay, yep. So the football field is really, I love that picture because in a snapshot, you can see immediately what the issue is. So that's Soldier Field. And for those of you who aren't familiar with Soldier Field, you can fit hundreds of thousands of people into Soldier Field. And what you see is that in an 18-month time period, you have over 600,000 people who have died from COVID. Now, when we look at influenza, we look at it over a 12-month period. So the Joint Commission took the last 10 years and they took the average number of people that died every year from influenza, and it was about 36,000 within a 12-month period. In 18 months, COVID has already killed way more people, 10 times more people than what we see annually with influenza. And so when people say,
180,000 is what's showing up on the screen.
okay, so the 180,000, that's since February. So that's between February and August.
Yep.
Overall, since the pandemic began, it's about 600,000. So, and if you look in the upper right-hand corner, because we keep hearing this, that, well, why should I get vaccinated? Because, I can still get COVID. And that's true. You may still get COVID, but you won't die. If you look in the upper right-hand corner, there's just this one little yellow row of people, and that's how many people have died from COVID that have the vaccine. And what we
Producers, can
know,
you go back to that slide for a second?
yeah,
If
so
if
what
you're
we
able
know
to.
about those people is that oftentimes those were very elderly patients. They had immune suppression issues, or diagnoses such as chronic cancers and chronic heart disease, chronic kidney disease. And, we know that those are the groups of people that are more at risk for getting severe illness and death, which is why, we're changing our guidelines for vaccines. But that is a very small number. Only 1,400 people out of the millions of people that have been vaccinated have died from COVID. So if you think about it, 600,000 people have died from COVID. Out of those, 1,400 of them were vaccinated. We have vaccinated millions of people in the United States. And so if you look at the numbers, it's about a 1 to 2% risk that you'll die from COVID if after vaccination. But again, that's in those people who have underlying health conditions that are really chronically ill or really elderly and their immune systems just aren't strong enough to handle the COVID vaccine after vaccination. So if you look at this graphic, this is just showing you, because people say, well, I can still get COVID if I get the vaccine, and that's true, but it's not as prominent as people think. Can we go to the next slide? So if you look at the number of people that were vaccinated who died from COVID, and this is just another way of showing you the football field. All the blue is everyone that died from COVID-19. The yellow is the number of people who were vaccinated. So again, very few people who have gotten vaccinated are dying from COVID. By far, more people are dying from COVID that are unvaccinated. And I'm sure everyone may be aware of the mother and father. There was a Black couple in Florida. Well, not in Florida. They were taking their 7 children on vacation in Florida, and they were undecided about getting the vaccine or not. And so the week before they went on vacation, they decided to get the vaccine, but they wanted to wait until after their vacation. Well, they never made it on vacation. The mother and the father both got COVID a week or so before the vacation, and they both died. So now those 7 children are left without both of their parents, which is very sad. So, what I want people to understand is that our community is being heavily impacted by this. And I don't know what we need to say to you for you to understand the importance of the vaccine, the safety of the vaccine, the efficacy of the vaccine, but it is safe, it is effective, and we all need to get it so that we can ensure that this time next year, we're talking about something else other than Black people dying from COVID-19.
Absolutely. And I think it's important for us when we have these conversations. Thank you, producers, for showing that graphic, by the way. Shout out to our production team, because this is not an
I
easy
know.
task to produce everything live. And we just be throwing different stuff. Well, we're gonna play a video this time. We're gonna add graphics. But thank you guys so much. I think it's really important for us as a community to also understand that the hesitancy and the fear, despite these
Mm-hmm.
numbers, are real.
Right.
And I think it's a little bit grounding and humbling when you see information like this, but the people who need to see this show often
Mm-hmm.
aren't able to see it, or
Right.
it may not be their cup of tea. And so how do we lovingly hold space for the people in our lives who do not want to get vaccinated or who cannot get vaccinated, because I've got both populations in
Right.
my life, and what I have seen is that a lot of folks who are vaccinated feel like they have to pressure and push those who are unvaccinated to get it, but they don't do it in a way that is loving, that's supportive, that's
Right.
informational. It comes from a place of judgment, and that's not helping
No.
the situation either.
No.
So
No.
what would you say is a more effective way to have the conversation of, hey, I care about you, I want you to consider this?
Right. Be honest, be authentic, and always share your why. When people, talk about vaccine, I always share my why. My son is 27, or he just turned 28 last week, 28, and he's a special needs adult. He has heart disease and kidney disease. He's had multiple surgeries on his legs. And, when he was born, the doctors gave him a year to live. And here he is 28 years later, showing them that God knows better than they do.
You never told
I
that part of the story, Adrienne. Look at
Oh, I
God.
did. I know. Look at God. And I'm like, how irresponsible would it be of me to take God's miracle and
Hmm.
risk it by not getting vaccinated and not getting him vaccinated and having him around people who are not vaccinated, knowing that his immune system is not that strong. He's fully vaccinated, but because of his immune system, he can still get COVID and get seriously ill from it. And he did have COVID pneumonia last year and then a resulting bacterial pneumonia because of it and was in the hospital. It was the scariest time of my life. I don't want to
Hmm.
go through that again. I don't want him to go through that again. And I've had to make some hard decisions. Like you, I have people in my family who aren't vaccinated. His father is not vaccinated. And so I have had to tell him, we love you and, we support your decision to do what you feel is best for you. However, you cannot be around him until you get vaccinated. I cannot risk God's gift that way by fragrantly letting him be around somebody unvaccinated. And the unfortunate part is he's home most of the time. He rarely goes out of the house, and this has been
Hmm.
over a year now for him because I have to protect him. He still wears his mask when he goes out. He's actually really good about wearing his mask. He does not play with, and if he sees somebody that's not wearing a mask, he just moves away from them.
Hmm.
But because of his immune system, I have to be extra, extra careful. And
Yes.
so, because of that, and I ask people, if they want to come visit, sure, you can come visit. Are you vaccinated?
Hmm.
Or if they want us to come visit them, are you vaccinated? If you
Hmm.
aren't, then I'm sorry, we'll have to do visit by video because I can't risk his life. His life is worth more than that. And so,
Hmm.
I
It's a
just
different
share my
ball game.
why. It is. It
Yep.
really is,
It's a different ball game for the immunocompromised community. And thank you for sharing that insight and
Yeah.
and what it's like to hold that fear and that tension,
Yeah.
especially. And for all of you out there who are watching, you can visit the Minnesota Department of Health website if you want more information on the COVID-19 vaccine. We've talked in previous episodes ad nauseum about why we have hesitancy within our community. And so please know, even on this show, this is not a place of judgment. You are free to do
No.
what you need to do with your
Hmm.
body. We just want to promote the information and then let you make an informed decision on what you feel like is best for you. And on
Right.
today's conversation, we're talking all about Black men's health, especially, and making sure that people know what options are available for them. We don't want our Black men to suffer in silence or to feel like the healthcare system isn't made for them. And so that's kind of what we're going to be pivoting to right now. Really quick though, Adrienne, can you tell us there is an event coming up at Tito's Barbershop where folks can get vaccinated? What's the details on that?
Yep. So every Friday and Saturday, the Black Nurses Rock Foundation is at Tito's Barbershop, and they are giving COVID vaccines to first-time vaccinees, and they're also giving boosters. So if you need a booster, you can go there as well. The vaccine is free. It's a judgment-free zone. You have smiling
Hmm.
Black faces there. Wonderful Black nurses to give you your vaccine. Sometimes Dr. Zeke shows up. He's always fun to hang around. And I've even seen Dr. Chomolo there as well. So if you haven't been vaccinated, and even if you just want to go talk to the nurses about why you're not vaccinated and get some of your questions answered, you can do that as well. So Tito's is the place to be this weekend. Go there, have some conversation, get a haircut, get a vaccine, and then go home.
Yes, and that's Tito's Barbershop on the north side of Minneapolis, right across the street from KMOJ, if you know where that is, at the intersection of Broadway and Penn. So, Adrienne, I was trying not to laugh when you said we got boosters because I'm like, that means something else in our community. But we're going to work to
We have
educate.
booster vaccines.
I was like, oh, okay, y'all got me. Well, that's what's up. Okay. Anyways, moving on with our conversation and centering Black men's health, I want to pivot to Mr. McFarland. Over the course of your life, Mr. Mack, as the elder on the show, I want to ask you, do you feel like you have been hesitant to go to the doctor when you may feel ill? And if so, why or why not? Oh, you're on mute, Mr. Mack.
There we go.
There we go.
I think growing up, I may have been hesitant, uh, and I shouldn't have been because we had Black doctors in a Black neighborhood where I grew up in Kansas City. And I do remember going to the doctor, going to the dentist, but we just didn't do it all the time. And I don't know the family history of that, of what shaped my point of view. But when I became an adult and married, my wife and her family had a whole different orientation about accessing healthcare, and I learned to pay attention and to be willing to seek out medical attention proactively, preventively, by the instruction and direction of my wife and partner, Bobby McFarland. So, and her family just was raised differently. They were educators, and in fact, many in her family are physicians and and nurses, healthcare professionals.
Yeah.
Maybe that's the difference. Presently, however, I believe that I have a deep appreciation for the miracle of science, for the miracle of knowledge, and for the availability of solutions that will help me live a productive and longer life. I'm approaching mid 70s now and have been obese all of my life uh, because of my daughter, Batala, who's one of the originators of this program. I
Hmm.
got into a physical fitness routine that led to the creation of our project. It was called Insight to Health Fitness Challenge. We began doing strenuous workouts over several 10-week rounds and involved other members of the community in trying to create a culture of fitness and support agencies, organizations, trainers, dietitians, people in the health and food industry to create an expanded conversation about health and wellness. Even through this period of time, I got to start riding a bicycle. I credit and thank Anthony Taylor with the Major Taylor
Hmm.
Bicycle Club. They got me
Yeah.
onto a bike. I used to see him and he'd say, Al, let's go riding. I say, yeah, okay, 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 and never did. And one day Anthony shows up with a truck and two bicycles, you know, and one of them's for you, brother. And I got on it and I kept riding and I've been riding and I love that. So it's being invited and encouraged and reminded that has made the difference. Well, after that, and as I aged, I am experiencing prostate cancer, that being treated at Mayo, and my diagnosis now is just be watchful. And then I've had an experience with congestive heart failure and being treated for that. So that's important. The key is that I'm paying attention, I'm listening, and I'm
That's
trying to
right.
follow the instruction, the direction of the professionals in the community that I rely on. The other thing that I do that's important is I have, in the past several years, sought out mental health services. All of you know Dr. Breveda, I think Garrett Akinsanya,
Yes.
Bacon's Health Services. So not only do I do business with them, but I'm their customer. I go to therapy every week. And the idea is to talk to people, talk to somebody who, as you said, is not judgmental, listens to
Hmm.
me, helps me raise the questions that I have about where I am and where I'm going. So the long and short answer is that I'm able to pay attention to health now differently. My hope is that in doing so and talking about it in places like this, I can encourage other Black men to have these critical conversations with themselves, their family members, and with the community, because we have to create a new narrative about owning our health. And I always say this, I'll close with this. I tell people that we have to take the attitude that our health is our business.
That's
Health is
right.
big business in this country and in the world.
Mm-hmm.
And we need a different attitude about it. And the attitude has to be one of equity, where we see ourselves as both vested and invested in the creation and maintenance of healthiness in our community, and understand the money associated with that, that's part of being healthy as well, being financially stable, secure, and competent. So I'll stop there.
Very
Can
well
we
said. And
pause for the cause just for 1 minute, Brittany?
yes,
Mr. McFarland, I did not know you were 70 years old.
I'm
You
70,
look
correct?
yes, I was getting ready to
amazing.
say it.
77.
We
So
Yes.
thank
have
you.
to recognize our people for that. You look amazing. I am so proud of you for owning your health and making it a priority. Keep up the good work. You look amazing.
Well, thank you. Thank you.
Yes, I was getting ready to echo that. Is I haven't seen you in person in such a long time because of the pandemic, but you look great. In spite of all of the health things that you're navigating. So the work is working. And I think this is exactly why we wanted to have this panel in the way in which we're having it. Because when you pay attention to your health and when you pour into yourself, it shows, and I really hope that it does motivate other people to not wait, until they are partnered. Although Dr. Nate is going to talk about sometimes that's what it takes. I hope people take care of themselves earlier on so that they can continue to make it to 70 plus, because you're not just 70 and working out, but you're still running a business and growing it every day and providing opportunities for people like myself. So just thank you. Thank you for all that you do. I want to pivot to Dr. Nate now. It's so interesting. Mr. Max said he started taking his health a little bit more seriously when he got married, which is something that you've kind of seen as a physician. Anecdotally, men take their health more seriously when there's a person in their life kind of yelling at them about it. What's that about?
Yeah, I think there's several things there, and also want to echo thanks for Alice, sharing your story and kind of really driving home some points that are I'm going to share some kind of literature and studies that show, exactly what I was talking about is the path we have for our community and for Black men to have more opportunity for health, really. And so what you're talking about, Brittany, is, what I've seen anecdotally when I'm in the hospital admitting someone who comes in is that oftentimes if someone has a spouse or a family member that's really vigilant about getting on them on their health, you need to go see the doctor for this, you need to get your checkup. They're coming in and their concerns are valid, but less, serious and immediate. It's the folks that have put it off and didn't have someone in their life who come in really sick. And then there's a lot less, I as a physician and our nursing team and everyone can do to get them back to health and prevent any loss of, ability, loss of a potential for a long life. And unfortunately, that's what we're talking about. If you look at the statistics for life expectancy in the U.S., Black men have the lowest life expectancy, 71 years before the pandemic, versus our Black sisters who are at 78. White men are at 76 years. We know that the pandemic dropped that by 3 years for Black Americans versus only about by a year for white Americans. And that's because one of the top three, causes of death was COVID in this last year. But prior to this last year, the other top three causes of death are heart disease, are cancer, and are stroke. And a lot of these things are preventable. And so a lot of this gap you see in life expectancy, it is preventable. But that requires, engagement with preventative care. And I think that's where we have seen, even just kind of zooming out for men across the board, we see that there's some socialized norms around seeking healthcare that do get in the way of, establishing regular care, getting preventative care services in particular, because the ideas of kind of resiliency and independence do kind of are how we're brought up as men of, asking folks for help. If you're not really sick, why are you going to the doctor? And then even some of the just interactions with doctors in general, I go there and all I hear is, a different diagnosis from this doctor versus the other doctor. You hear stories of like, I go there, I already knew what was wrong with me. They just told me what was wrong with me. And then they sent me a bill, and so like these bad experiences permeate. And there is evidence that your own family's experience, again, like, I was touching on, influences your engagement with healthcare. And so if you were growing up and your dad and your family sought regular care and preventative checkups, you're more likely to do that yourself. And if they didn't, then, you're less likely, unless you have someone in your life come in and kind of change that perspective. And then when they looked at Black men specifically, things in particular that have contributed to less engagement with care beyond those kind of experiences are concerns about cost, are concerns about access, We found that Black men who have more education, have higher incomes, are more likely to go see preventive care. And so I think that speaks to, we're going to talk a little bit about insurance later, but I think what it signals to me is that, and what you see in our community is that our healthcare systems have kind of been systematically, historically, structurally designed to exclude us from health and engaging with healthcare, and that sends a message, to communities. And so it really is upon us in the healthcare system, as a physician, as nurses, for us, and I think this touches on what you're talking about around vaccination, is to continue to show up and have conversations and meet people where they're at, do it in a non-judgmental way, and continue to try to provide that education of what are the benefits of establishing regular care, what are the benefits of seeking out advice, from qualified professionals in your health, and how can that be added on to other things that I'm sure other people on the panel talk about, that you can take control of your health in some of your lifestyle choices and in your interactions. But really getting in and getting that preventative screenings are some of the things that we know that men across the board, and then Black men in particular, just don't do as often, and that leads to less opportunity for health.
Very well said. I want to pivot to TC now, who you are a wellness practitioner of your own, but you take a more natural and holistic approach to wellness. And so I'm curious, from your perspective as a young Black man, when you think about like the existing medical system that we have today here in the US, do you feel like it serves Black men like yourself?
From my personal experience, I will say I'm on the fence about it, just because I know we've had to use Western philosophies, their institutions, as far as for trying to get forward in any type of aspect. So I'm not going to be naive to say I haven't received any adequate care from the health institutions. But the age that I'm at now, when I go into a hospital, I can immediately tell if I'm gonna receive the type of service that I feel like I should get. And that's the discussion about health equity. Like when I go in there, I don't want to be treated like I'm coming in here seeking some type of substances that people get addicted to, which I've had that experience when I'm telling them about some pain that I'm having, and feel like, you get the feeling like you weren't heard. And for me, if you treat me like that, that makes it easier for me to walk away and not want to receive care from you. I'm like, first of all, I'm not going to get a large bill where all you did was give me a stent for a wrist and give me some ibuprofen that I could have got out the store for $7 and you charged me $300. So it's those type of experiences that push me away. And then the history of the healthcare, system, which goes beyond just the Tuskegee experiment, but we talking about centuries of systematic racism that has been perpetuated against us, and that isn't just going to change over a conversation where you telling me, oh no, you should trust them, trust this research that they did, from my understanding, it has not been anything that the U.S. has given in masses or given to masses that didn't have an adverse effect against them. And that's just my standing point on it. But I'm also pro-choice on people making up their own minds, making their own decisions for their own bodies. So that's what led me out of the pandemic, looking at people as a whole person instead of just breaking it down into sections from a mind, body, spirit lens. The food or the whatever type of information that you put into your mind, that you put into your body, it plays a overall effect on who you are as a being, who you are as a person. I did have COVID back in November, late November, early December. And I'm very self-aware, and I remember how I felt during that time. And I remember what I actually used to get over it within 3 days, but I still had to be quarantined for 14. I had the effects of and the symptoms for 3 days. And once I started taking my health into my own hands, which I was doing before, is being aware of what I'm putting in my body, which was whole foods, raw foods, herbs, things like that we have used for timeless, have used for forever. but we've gone astray from it to putting more things that's causing our bodies to have mucus or causing our bodies to have these built up type of toxins that's in there. And that's just even away from the vaccine. I won't comment on that, but what I will say is the foods that we're eating plays a part in that. No, I started using essential oils when my smell left, and that brought it back. I started eating nothing but raw foods, which, I know is hard. And like the brother McFarland said earlier, it's like we have to have access to these type of things, as a culture in our community, at least have the access to it before we just get to talking about putting something foreign that's in your body because people have their research on it. Okay, before you do that, let's try to retrain what you are ingesting. Let's start eating to live instead of eating to die. Let's start eating these things that will affect you in a positive way instead of, okay, if you do take this shot and you continue living, your life on a diet that's not sustainable to your well-being. So what I tried to introduce was more of a health nutrition coaching for our community, teaching them body-based activities. Because like the sister up there above me said, like during the pandemic, she sat in the house and had to get used to like being in the house and not moving around. Well, our body can hold trauma and it cannot be released unless it's through body-based activities for some people. Our culture is very different from a lot of other cultures. I'll just say that our culture is like where some people might think it's therapeutic to sit in front of another person and vent, as opposed to me. I can go sit in the barbershop and get my hair cut and talk to my barber about something that somebody might talk to a therapist about. I might need to create some music. I might need to write it out. I might need to dance. So one of the things I did during the pandemic was become a yoga teacher because I wanted to bring more Black men, which was my emphasis, Black men and Black boys, over to moving their bodies around and releasing a lot of that complex and compound trauma that we find within ourselves. And then using that as an opportunity to introduce them to new foods, new fruits, new vegetables, or at least educating them on whatever you're putting in your body, how it plays a part on how you thinking and how you behaving.
So TC, with the work that you've been doing, what would you say when you're working with either Black men or Black boys, what's been the biggest barrier to the population that you work with being able to tap in and really focus on their wellness?
For me, I would say ignorance. What you don't know is what you don't know. I just happen to be blessed to where I've put myself around people or went through college or a football system that they teach you about health and nutrition. And it's like, it's a barrier for that because as we growing up, we don't have somebody sitting down, actively engaging with you, telling you this the same way that they would do, like a coach that has a player. We need more figures like that in our community that could break it down in a layman's term, that's not just speaking from clinical and medical terminology, but like, hey, brother, hey, look, check this out. You don't need to put that in your body because this is what's going to happen in the long run. And that's a proven fact this going to happen. So if you change your diet to this, you're going to think more clear. And if you thinking more clear, that's going to affect the choices that you're making. And like if you speaking to somebody or somebody, a young man of color like that I found it's easier to get them to digest that information. Even I'm not saying it's going to change overnight, but starting to even curate a space for them to have those dialogues because it's taboo. I don't see a lot of I don't have my homeboys or when I was growing up, somebody telling me, hey, bro, put that fried chicken down. Try this. Hey, did you know that you can get your protein from plants? I didn't learn that until I was about 26, 27 after I'm done with football. Once I started getting into yoga and getting into Eastern philosophies on how I should treat my body like a temple and, not just talk about it, but actually be about it. And what I noticed is like these brothers, they want the information. They thirsty for it. They just don't know, they thirsty for it. Once you introduce it to them, they take it from there. But you don't have an environment that's reiterating that. You don't have an environment that's reiterating them to make these healthy choices or make these good choices. And it's harder to hold their attention span for so long unless you are somebody of that culture or somebody that they can relate to. I'm not finna hear nothing from this white guy who's coming in a suit telling me about myself. No, but I am gonna listen to this brother who walked the same life as me in his younger days, and he has this sternness in his voice, or he has this type of character or aura that's gonna command attention. And that's another barrier. Just, I think the biggest barrier is just having access to these type of things and being intentional to make it accessible, which will only come from us to make it intentional.
So you're starting to fit services, our audience coming, or can you guys hear me?
It's kind of distorted a little bit.
I'm gonna go here. I'm gonna get experience with wanting to.
I think you're kicking it to me. Okay. So yeah. So I think it was one of my personal experiences in impacting my decision, to become a physician. And so, I didn't see many doctors that look like me. In fact, really none until I was in college. But my dad was a pharmacist, my mom's a nurse. And so was exposed to medicine and the ability to kind of help folks, and really appreciated that, when we were in community, that folks would come up to my dad and ask questions about their health and recommendations, and he'd be able to help point them in the right direction. And so always saw a role as a healthcare professional being what you do in your clinic or hospital, but also what you do in the community to help connect folks to information and care. And so that's what led me to medicine, and really liked working with kids. Coach soccer, was a camp counselor, so looked to work with kids as well as adults in my practice. And I think so many of the things that TCU was talking about, really resonate, as far as it's one of the things we see is that, folks don't trust medicine because sometimes we're much too quick to just say, here, take this pill. And that's the amount of advice we give around health, and don't really approach the more holistic views of the impact of things like a diet, and help folks think about and access healthy nutrition, think about and access healthy lifestyle changes, and ability to do exercises or like yoga or other things that could really help them along beyond just writing a prescription, or even beyond prescribing vaccine, doing a better job of really looking at whole person health is one of the things that I think there's lots of opportunity to do, and I think and I'm hopeful that when we get better at that, that will help with some of the gaps we see. But really, that's one of the things that I'm hoping and trying to do in my practice is connect with folks at that level, share that shared experience, and what we've seen is that we get more Black physicians, that actually also helps improve, because when we studied it, Black physicians more time with patients, particularly Black patients, there's better communication between a Black physician and a Black patient. There's a better understanding of what the actual options are, and so then folks make decisions for their health when they have that better understanding. And so I think there's a lot we need to do to improve the physicians we do have, but we definitely need to get more Black physicians, Black nurses into the mix as well, because that's been shown to help too.
So, Dr. Nate, Brittany posted another question for you. How can people find a primary care doctor? What are your recommendations?
Yeah, that's always a great question. Usually starting with your own family and friends for recommendations is a really great place to start, particularly if you're looking for a primary care provider of color. There's not a lot of us in the Twin Cities or in Minnesota. And so, even nationally, I think only 5% of physicians are doctors, and, nationally 13%, 5% of physicians are Black doctors, and nationally we make up 13% of the community. So there's gaps there. I believe the African American Leadership Forum had a database, or was compiling a database of different providers to reach out and find different Black providers that way. And then, if you're seeing a provider that's not same race as you, there are other ways to kind of like advocate in those interactions. And so really getting to know your doctor's name in a way that can build rapport and accountability with them. And so you let them know that you know their name. Bringing family friends with you can help. And that's been shown to help improve understanding and communication in those situations. And then, asking to review your notes. There's actually an ability now to review your own notes. And so you can make sure that the information you provided them and then your understanding of what they were communicating to you is accurately reflected there. And so those would be kind of some of the steps to, both finding and then having, more success with, primary care in our current system while we continue to work on improving it.
All right. Can you guys hear me now? Excellent. Okay. So in order for you to really establish primary care, though, you still have to have coverage. And I know open enrollment is coming up. Can you talk to us really quick about how folks can get in and get insured if they haven't been already?
Yeah. So we know in our community there's a higher rate of uninsured. So about 10% of Black Americans are uninsured as of the last census data. So open enrollment is the time when you can access healthcare insurance through MNsure, or so www.mnsure.org. And that's, if you've heard of Obamacare or the Affordable Care Act, that's your way to get a plan through those services where the federal government and our state are helping chip in and cover some of the cost. And so there's examples on there of, for a 25-year-old making less than $30,000, single guy to get coverage for, $18, as little as $18 a month. If you go look on MNsure. And so there's a lot of options there. You might qualify for coverage that has, no premium. So you go and see the doc and you don't need to be paying a monthly fee. You don't need to be paying a visit fee. And so looking at MNsure.org, or if you go to our DHS site, mn.gov/DHS, you could also find information there. But yeah, that coverage period starts November 1st, goes through January 15th. And so please, check that out, spread the word. If you know someone that doesn't have insurance, they should check it out and find that they might be surprised that they'll qualify for pretty low coverage right now.
Definitely. And if you are watching and you're looking to tap into more of the holistic wellness, TC, I'm sure you don't require insurance for the services that you offer, but how can people tap in, get involved, and connect with you?
Well, right now I do have a website under construction. So right now they can access me through social media under my name, Thomas Collins, on Facebook. Instagram is MBSW Holistic Fitness. So it's holistic, but with a W in front of it. MBSWHOLISTIC Fitness, FITNESS. That is my Instagram page. And you can reach me through my business line, which is, sorry, let me unlock this phone. 763-200-7833.
All right, and we'll have both of those resources. There we go. Shout out to our producers.
Shout out to the producers. Thank y'all very much. That was quick. Thank you.
So that's how you can reach TC, Mind, Body, Spirit, Holistic Fitness. Is there anything else that you want to let our audience know, especially our Black men, as it relates to just tapping in as we wrap this conversation up?
And I'll try to keep this as quick as I can. I go hard about young Black men just because I know how lost I was at that age and how we can sit here and talk about this, but we cannot deny the fact there's something going on with our community, with our young brothers. And me coming from that culture, I feel like I can relate to that. And I want to, like one of the brothers said, be preventative. Instead of just continue waiting on the destruction to happen, let's teach them how to be reconstructive of the mind, restructure their mind to actually having that self-esteem and self-worth and self-love, to when they look at the next brother, they see this love and they acting out of love, not just with other people, but with their bodies. You know what I mean? We have to take our bodies and our minds back for our community so we can not continue, but rebuild our community. I feel like it start with us. And that's what I just want to, I go hard about young Black African-American men, period, and just our community. So this is my way of giving service to it, or paying it forward with me being blessed to make it out of the situation that I was in.
Well, thank you for doing what you do. And we appreciate it. And we definitely want to have you on the show to continue to help educate our community and let them see that it doesn't matter what you have been through or where you come from, but that you can still make it through. You can get in control of your mental health. You can reclaim your body and make sure that your mind and your body are connected. And another way that you can do that is by engaging through other means of physical fitness. Mr. McFarland, can you talk to us about the Insight to Health initiatives and how people can get involved with the challenges that you do, and also all of the amazing conversations that you and Batala have been having?
Well, Batala's organization, our company organization under Batala's leadership, is called IHEAL. IHEAL stands for Insight Health Equity Action Lab, and it's an elevation of the project we started, which was called Insight to Health Fitness Challenge. We haven't done the fitness challenges in the past year because of COVID, but expect that as we move towards people being able to get out and to follow protocols and to have more vaccinations, that we'll launch again the fitness challenge. The challenge concept was that people would get together and work out 3 to 4, even 5 days a week. We were meeting, I think, 4 days a week at 6 in the morning, even through the winter, down at the Heritage Park YMCA. We also did programs up at MENI Fitness on the corner of Plymouth and Penn. But the idea was to create a program where 20, 30 people would meet on a regular basis for 10 weeks, establish some goals, some baselines to weigh in, and to help people meet their goals by not only the physical exercise, the calorie burn, and the dedication to the project, but also enjoy the support of nutrition coaching, mental health coaching, the support of knowing that what you're doing and where you're doing it supports your community. We were intentional in working with Black-owned businesses, therefore MENI, or Black-led organizations, therefore the Heritage Park YMCA. And we were intentional about bringing in Black nutrition experts, Black mental health resources, Black physician resources to support this work. The IHEAL proposition is to relaunch that, but in the meantime, work with organizations. Right now, we're working with the Minneapolis Heart Institute to create programs, conversations like this on heart health and healthy lifestyles, and what our stake is in directing that and creating the conversation in our community. So look for us to continue that. I'll say one more thing, Tiffany, in support of what the other guests have said about insurance. And my argument is that if you have the insurance, you work for a corporation or government, you've got a good insurance plan, let's be really, really, really intentional in getting everything you can for the investment you've made in insurance. So you ought to be thinking not only about all you need and all you can get from that insurance to keep you on the path of health and healthfulness, but how do you use your dollars to build the capacity to deliver health to you and other people in your, meaning our community. Be intentional about seeking out Black physicians, Black dentists, Black mental health people, Black nutritionists, trainers, yoga studios, etc. Be intentional and be proud of our ability to engage each other to reflect this idea that our health is our business.
It absolutely is our business. And we want to thank you, Mr. Mack, for everything that you do in our business, especially with Insight News being the media partner and the reason that I get to come into this space every day. Thank you to our panelists for all of the work that you do in your respective spaces to just help people heal and to connect to their bodies. And particularly, we typically have a lot of women on this show. So it was a treat to have 3 Black men up here talking about the different ways in which they've come into their own healing journey and how they're helping other people facilitate their own wellness lifestyles. We could talk for a whole nother hour. And in fact, we will, just not today. So join us in 2 weeks. That's Wednesday, October 11th from 11:30 to 12:30. We'll be right back here on the African American Leadership Forum Facebook page, as well as the YouTube channel to talk about Black men's health. So be sure that you come back and join this conversation. But we're going to wrap this one up today by saying thank you to all of our viewers. Thank you, of course, to our producers for holding us down and mitigating through all of the technical difficulties. It's not an easy show to produce, especially doing it live, but we do it for you every other week because we value you guys and we value being able to communicate to our communities in this way. I want to give a very special thank you to our sponsors, which include the Minneapolis Foundation, Northpoint Health and Wellness, and Children's Minnesota. I also want to give a very special thank you to our partner organizations and our producer organizations, which include Northpoint Health and Wellness, Children's Minnesota, Insight News, Gray Matter, the Spokesman Recorder, and Minnesota Community Care. And of course, you can visit the COVID-19 hotline if you have questions about COVID and where to get tested or where to get vaccinated. All of that information is up on the screen as well. We're getting ready to wrap up the show. My name is Brittany L. Wright with Insight News. It's been a pleasure. As always, be good to yourself, be good to others, and we will see you next time. Peace.